Hello, good morning, everyone, and welcome, Dr. Rapaport.
Hey, it's good to see you again.
Yeah, it's been a while, but so everybody's in for a treat today. We're going to learn some new innovative developments and techniques relating to the subject of non-surgical hair restoration, and particularly using exosomes. Now, when was the first video we did on hair restoration, doctor, was what, 5 years ago?
Excuse me one second. I'm just turning my phone off. Okay.
No worries. 5 years ago?
I think about 4 years ago.
Because when I look at the YouTube video, 4 or 5 years ago, and then we did an update about 2 years ago on PRP.
Right.
So I think it'd be wise in this session to really uncover, because I'm learning more about exosomes and hearing it more in the integrative medicine world. But just before we start, in the last 4 or 5 years, how many patients would you say you've treated now for non-surgical hair restoration?
Probably close to 3,000 patients.
Wow, that's an incredible number.
One of the busiest doctors in the country for non-surgical hair restoration.
Wow, incredible. So exosomes, that's what I want to talk about today, exosomes, if I'm pronouncing that correctly. So I'm hearing more in the anti-aging integrative medicine world about exosomes, but just for the person, what are they and how do they differ? I think the confusion often is how they differ from PRP, stem cell. How do they fit in? What are they and how do they fit in with stem cell PRP?
Exosomes are microvesicles that are given off by cells that are part of an intricate messaging system from one cell to the other. So we know that cells communicate with each other all the time. And the way that they communicate is with something called the paracrine system. And the paracrine system is mainly mediated by exosomes. So exosomes are created by one cell, and if it wants to talk to another cell, it pinches off this little vesicle, and then it's very smart. It puts the intended recipient for the vesicle on the outside of the exosome, and then the exosome travels either through the blood or locally or through the lymphatic system and goes to the targeted cell. So exosomes are cells that are intended to communicate with each other.
Uh-huh.
Exosomes have a lot of different contents. They have several different types of proteins, including cytokines and other types of protein. They have messenger RNA and microRNA, so they have a lot of different potential ways that they can function. Recently, we are seeing exosomes used for, as you said, orthopedics. We're seeing it used in regenerative medicine. We're seeing it used in dental medicine. We're seeing it used in neurosurgery. We're seeing it used for cardiology. And in all of these, as in any regenerative medicine, we're taking a result that we see in terms of improving or recreating a growth situation and using it for something that it wasn't really intended to do, but we're reusing it for something that's helpful for mankind.
Okay. Would it be helpful if I just upload? I know you sent an image. If I just share the screen here, would it be helpful? Can you see that image?
Okay, so this shows the contents of an exosome on the left side. It has microRNA, messenger RNA, and plenty of intracellular proteins, and then has these lipids and other things on the outside so that it goes to the intended target. And you'll see on the right, as it's going to the intended target, the target that it's intended to recognizes the signals that are on the outside and takes it in so that it can go to the nucleus, and all the functions of the cell are primarily controlled by the nucleus, and that's what we see by the secreted proteins in the exosome and in the live cell on the right.
Okay. And I have this other image as well that you sent.
This shows exactly how the exosomes are made. We have what's called the microvesicle endocrine environment, microvesicle environment. And these microvesicles in the cell, as part of the endoplasmic reticulum, are shown to be creating proteins and other things. And then you can see the exosome gets, there's a little, the membrane seals it off, and then you can see that it's being spit out on the number C.
Right, I see that. They sound like little clever things, these exosomes. So,
well, originally, exosomes were thought to be getting rid of waste products of the cell. That was years ago. But now, as we get more advanced in cell biology, we know that exosomes are really the communication product and are extremely important. And in regenerative medicine, we're trying to utilize a function that really wasn't intended for our own use.
Interesting. So specifically using exosomes for non-surgical hair restoration, how do they differ from PRP or stem cell that I know that was being talked about for many years, or is it an adjunct or replaces?
You know, I always come to you with the newest information when I think that there's a topic that is at the forefront of hair restoration and dermatology.
Correct.
It is so new at this point. My colleague who has the most experience with exosomes only has 9 to 12 months of exosome experience. I can give you what I think my interpretation is as to the place for exosomes, but we really don't know. Exosomes are so new. I still think PRP is the gold standard for non-surgical hair restoration. I think PRP works for anywhere from 65 to 85% of the population, depending upon what the reason is that they may be losing their hair. And for the majority of people, PRP is a very, very good treatment for hair loss. There are some people that PRP doesn't seem to be, that small percentage doesn't seem to be doing as much as it could. That, for the most part, has been people who have lost their hair for longer than 5 to 6 years. Such as when you asked me, we did our last video, you wanted to know, is there anything that PRP could do for you? And I was forced to say no, because there really isn't. I think exosomes has the ability to do follicle regeneration and also follicle creation, which PRP doesn't have the ability. So people who have lost a greater amount of hair where PRP would not be helpful or would be minimally helpful for those people, those are the ones that we are suggesting try the exosome treatment.
Okay, so how is the treatment delivered? Do you have a proprietary method, a proprietary protocol? How is it delivered?
Everybody has their own way of doing it. Of course, I've developed my own treatment method. I really believe that the best vehicle for carrying exosomes is PRP. And we do put our exosomes in PRP, and then we use the technique that I developed and that has been written about called subdermal depot injection. So we put these exosomes into the PRP, we add, we mix it in the syringe, and then we inject it using my subdermal depot injection technique. And I think that the injection technique is extremely important. People do all sorts of, some people do microneedling and other things, which may be helpful, but I do believe that the injection technique and the location of the injections is a key factor.
Right. So what's the sort of success rate of this procedure to date? Do you have enough data to support any success rate to date?
Well, I'm coming to you pretty early in the scheme of things. I've done about 15 patients, and out of the 15, we've had good results with 14. I've also, out of the one that didn't progress, it was one of the women that had scarring alopecia with something called frontal fibrosing alopecia. And I thought with the follicular neogenesis and follicular generation that we may be able to get some results, because this is a disease that you lose hair follicles, but we weren't able to do very much with that. Having said that, the people with male pattern hair loss, female pattern hair loss, and even alopecia areata have responded very well to the exosome treatment.
Right. So are there any side effects?
Well, anybody who tells you that there's no side effects to a treatment is not really being honest with you. I think that side effects are very, very much related to the company that produces the exosomes. Since I started looking into this, there's probably 20 companies that claim they're exosome companies. And it's extremely important to select an exosome company that is has an FDA-approved production facility that does strict tests on sterility and communicable diseases, and that has a good safety profile. There are a lot of companies that are out there that I really wouldn't select to work with me. Having said that, no procedure is 100% safe. You're talking about something that goes under what's called an allograft. That would be the same thing as if you went in and had an orthopedic procedure and you needed a meniscus, or you needed a tendon or a ligament put into your knee. The way that this is done is that there are bone marrow donors, and the bone marrow donors produce the stem cells. The stem cells, as I showed, will be cultured and minimally manipulated so that what happens is the exosomes are produced, and those exosomes are what's used. Now, this whole production process has to be done in the finest manner in an FDA-approved facility, in a place that you would feel, that I need to feel comfortable that are going to produce something that is sterile and free of communicable diseases. So having said all that, you can't say that it's 100% risk-free. The company that I've been dealing with has yet to have any potential side effects, but nothing in this world is 100%. I would say that it's low risk, but it's not risk-free.
Right. Okay. Now I want to show some, I want to share the screen again because we've got some photos that you sent.
I wanted to talk a little bit more when we're done after the photos about the different mechanism of action between PRP and the similar mechanisms of action.
Okay, well, definitely. Can you see the image on the screen?
Yes.
So if you, I know you sent a few images. If you want to just talk us through
this is actually a gentleman that we did in 4 weeks, we were able to take him from the left to the right. Now, he had been getting PRP for 4-5 months, and this was the most we could get. Within 4 weeks, we were able to produce this result on the right. And so while this picture is up, I want to mention a couple things. The rate of regrowth and the rate of hair regrowth with exosomes is significantly faster than what we've seen with anything else. I believe it has to do with the messenger RNA and the signaling proteins, which are signaling the dermal papilla cells. But the rate of growth and the amount of new follicles produced is significantly more with exosomes, I see, than with PRP. And I could show you, there's one more picture which you don't have, which is 1 week afterwards, he significantly has more hair. Mm. We never get hair to grow at this rate. And my colleagues and I are looking into it, and I have theories that the messenger RNA and the other portions and the microRNA are affecting the dermal papilla cells and these dermal papilla cells are communicating with certain parts of the hair follicle, which has stem cells, and are really getting them to replicate and faster and to produce new follicles. And we don't see this with PRP. PRP produces excellent results, but takes longer to get to those results. We don't have the exact answer as to, we have hypothesis, and I'm going to be sending a published paper to a couple of journals for acceptance, but I think the exact mechanism of action is yet to be determined.
Okay. So just so I'm clear, the image on the left is as far as you got with PRP, and then with the
Yes.
exosomes, you got this additional boost on the right.
In 1 month.
In 1 month. Wow.
And then when you see his picture now with 1 week later, it's just 25% more, which is so difficult to fathom because it doesn't follow any of our previous scientific hypothesis. There's got to be a new hypothesis, which I've thought of a couple different ones, but there's a new mechanism of action that we haven't seen with PRP.
So would it be safe to say that the over 3,000 patients you've worked on over the last 4 or 5 years for PRP and hair restoration, would they be suitable candidates then for this additional boost using exosome?
Well, most of the PRP candidates that I've done are extremely happy with their results. And they, it may have taken a little bit longer, and they're maintaining, so they're happy. So those, not all of those would be suitable for it. I think people that are suitable are the ones that did the PRP and didn't get as much improvement as they want, who have lost a significant amount of hair from the beginning, maybe 60, 70% of their hair, and they really need a more exaggerated treatment. I think that you must consider the cost of this treatment. This treatment is significantly more expensive than PRP.
All right.
Anywhere between 3 and 4 times more expensive. And I'm considerate of my patients' expenses, so that if we can get results with PRP, then we don't need to continue. We don't need to switch to exosomes.
Okay, understood.
If someone has lost hair, for instance, the first time that you and I talked, you asked me if I could help you. And the bottom line was that you had lost hair more than 5 or 6 years. People whose hair has been gone more than 5 or 6 years, those are candidates for exosomes. People that did not get responses that they're satisfied with PRP, which is a very small percentage.
Right.
So it's really, I think we're still working out the ideal candidates and who is the ideal person to benefit from it. But I do think PRP is still the gold standard. Here's a gentleman who happens to be my dentist, and he had tried PRP and he didn't really get much of a success. And then this is 1 month later, and you can see the amount of regrowth that he has using the exosomes.
Right. Yeah.
So we're using it for PRP patients who are not where they want to be. And this is my own head.
Oh, okay.
And I had that bald spot in the back of the head. And if you look closely, the size of the bald spot is significantly less. And there are new hairs that are growing throughout the whole area of the bald spot. And this is about 4 or 5 weeks afterwards. So I've tried it on myself, and not only is the bald spot thicker, but the top of my head is thicker. And I've been pretty impressed with the results. And that's why I decided that it was time to do another video with you, so the public understands exosomes, I hope, and realizes we're in the initial stages, so you can't make any final conclusions. It's such initial stages that some medical practitioners may even consider it quasi-experimental, but it's going to be around. It's going to be a major player in non-surgical hair loss. and people need to know that it's an option.
Totally understood. Are you expecting this patch to fully grow in, or is that the hope?
I don't know. I mean, the thing about exosomes is that you can get hair to grow where it doesn't seem like there's any hair follicles. And that's because it synthesizes, well, it gets folliculogenesis, and it can regenerate old follicles, but it can stimulate the production of new follicles, which we were not able to see with PRP. And that is one of the big differences.
Right.
So I don't know. I don't know. There's a lot of things we don't know. How often you need to be treated. We don't know if one session is enough. The protocol that I've developed includes some continuation with intermittent PRP to keep things going. No one knows the protocols because it's very, very, very early, and there have not been any rigorous double-blind clinical trials or even simple clinical trials in the literature. There are some excellent articles. There's an excellent article from 2019 in the Dermatology, one of the journals on experimental dermatology, that gives a good explanation and verifies that it does work in cultured human cells, but there really aren't any articles that appear in the dermatologic literature regarding hair regeneration with exosomes. I think there's plenty more to come.
So it's all fascinating, these exosomes, totally fascinating. How would somebody self-identify themselves as a suitable candidate? I know you broached on the subject a few minutes ago, but if you were with a patient now, how would you, somebody tell the audience how a prospective patient would identify themselves as maybe suitable?
Well, I think a patient can have an idea that they want to do non-surgical hair restoration, and they should go to somebody who specializes in non-surgical hair restoration, somebody who specializes, who has used PRP and who knows about the different treatment protocols for PRP. And when you come in for a consultation, you need to be assessed as to which one you would be. Is it PRP? Is it exosomes? What's your financial limitations? What expectations do you have? How long you've been losing hair for? What have you tried before? There's a million things that go on in the consultation. But finding someone who has experience in non-surgical hair restoration, I think, is the key to deciding where you want to go. And it's always a question of options. Consultations are about options. You give the patients the options, it's informed consent, and let them decide which way they want to go.
I know there's other doctors that promote exosomes now, and it's becoming that buzzword, if you will. Are there some questions that somebody, a prospective patient, should ask other physicians before deciding on who to actually work with?
Well, there's two parts to that question, because the physician chooses the company who makes the exosomes that they're working with. And I have spoken to two other of my colleagues who are very knowledgeable people who said they had exosome treatments 2 months ago and they got no results. So exosomes are not exosomes. Not only is there a difference in the number of exosomes in an exosome treatment, but there's also a difference in the source of the exosomes and therefore the contents of the exosomes. And the contents is the key with the exosomes, knowing what's in the exosome and that the contents are going to work for hair stimulation. So when you go to a doctor, you need to find someone who's extremely reputable, somebody who has a name in non-surgical, or there are some of the hair restoration surgeons that are starting to get into this also, and make sure it's someone who is reputable and that they're getting the exosomes from a reputable company. As far as I'm concerned, there are probably only 2 or maybe 3 reputable companies producing exosomes. So the doctor has to be reputable, the doctor has to have experience, and he has to be using exosomes from a reputable company. And you need to ask the doctor to see pictures of what their non-surgical restoration, hair restoration. I wouldn't go to anybody who doesn't have experience in PRP, because PRP, I think, is the gold standard. And for most people, PRP is the choice rather than exosomes. And once you've met with the doctor, the two of you can decide.
So not all exosomes are the same then?
No, it's very, very tricky. I mean, I pay a lot of money for my exosomes, and then I see some people advertising you can buy exosomes for $70. So,
oh wow!
Now what we pay is thousands of dollars for exosomes. So it's very, very diverse in the number of companies, safety of the individual companies, what's in the exosomes, how the exosomes are injected, what your choice is, what the treatment protocol is. All of this is, you're relying on a doctor who has experience.
Right. Now, just speak to that, Doctor, regards experience. I know you, Dr. Rapaport, you travel extensively nationally. I'm not sure whether internationally, but I know you travel extensively, educating and teaching other doctors and physicians how to do non-surgical hair restoration with PRP. Can you just speak to that?
Thank you. Yes, I've gone around and basically ran around with the flag for PRP, because when we first started talking about it, it was as new as exosomes are now, and people really didn't understand. And I've been around the country teaching the protocols and the science, et cetera, et cetera. I now have two chapters in PRP books about treating hair loss with PRP. I have 4 or 5 articles in medical journals about how to utilize PRP and about PRP. I give lectures at the major national meetings to other dermatologists about PRP and hair loss. So I have a lot of experience with PRP. I've treated thousands of patients, and I think we have a lot of happy patients.
Excellent. Excellent news. Do you have any predictions for the future of exosomes, or particularly the subject of non-surgical hair restoration as a general?
I think exosomes are a major advance. There's a couple things that if the price can come down, that would be one thing. I think we have to deal with that. Number 2 is there's concern about FDA regulations on exosomes. So we don't know exactly, even though right now it comes under the allograft section, but there's going to be FDA rulings, and that will determine very much how exosomes will proceed, whether they will advance very quickly in the hair restoration market, or whether that's going to be significantly slower based upon FDA decisions. I think that there is going to be a major paradigm option shift, so that people are going to have 2 significant options, PRP and exosomes. And as we get more and more studies on the exosomes, it will, provided that the FDA regulations do not change, I think it's going to continue to make inroads into the non-surgical hair restoration community. Unfortunately, as physicians, we have to abide by what the FDA says, and right now it comes under an allograft ruling, which is basically the same thing as I told you, putting something in your knee, et cetera, like that. But the FDA, I know, is planning on reviewing it, and hopefully the FDA will allow the quality companies to continue to produce the exosomes.
Fantastic news. It sounds very innovative and exciting. Thanks for sharing all these insights.
Thanks for having me.
I know we're going to be 12 months from here looking at a lot of more before and afters, and
no, it's not going to be 12 months, because I'm going to come back to you pretty quickly on, we did a couple of the PRPs. There are people that still tell me they see our PRP videos, because we did videos basically before very many people knew about it. once again, we're making a video before people really understand the depth and the efficacy of exosomes. But I'll come back to you a little bit quicker than we did last time, because things are going to be changing rapidly as studies progress, and I'm going to be doing investigations and others will be doing investigations.
Well, I'd love to hear those new developments and insights. So whenever we need to get together, let me know. That'll be perfect.
Thanks for inviting me.
So just to close on this, if someone is interested in discussing PRP, hair restoration, exosome treatment with yourself, what would the next steps be? How would they go about working with yourself?
Well, my office is still in Englewood Cliffs, New Jersey. You're going to put my name up, I think, eventually, or
oh, we'll have the contact information above.
have the contact
Below,
information.
around.
Just call up my office, 201-227-1555, 201-227-1555, and we can discuss exosomes. If someone is interested in exosomes, I think that we can discuss PRP. We can discuss all the different options. I think that a complete discussion will be necessary. And if you contact my office, 201-227-1555 in Englewood Cliffs, I'd be happy to meet with you and give you my suggestions. I think a complete consultation is necessary for people to decide their options.
Excellent. Well, thank you for that. Good. Well, thank you very much, Dr. Rapaport. This has been very, very interesting and insightful today.
I appreciate your time.
Good. Well, thank you.
Take care.